I'm Dr. Ryan Tibbetts, a shoulder specialist at Texas Orthopedics. The rotator cuff is made up of 4 muscles that compromise the stabilizers or smaller stabilizing muscles of the shoulder. A rotator cuff tear is a tear of the tendon away from the bone. The older you are, the more at risk you are of developing tendonitis. The tendon becomes degenerative, and then you're more risk of having a tear. Younger patients can have an acute tear that's related to trauma. People end up with pain, usually with lifting their arm, with overhead motion. Night pain is something that people have trouble sleeping. You can treat rotator cuff tears conservatively, a lot of times with activity modifications, injections, physical therapy. If people have tried this and are not getting better, that's whenever we begin to talk about surgery. It's like taking a small drywall anchor and placing that into the bone, and that has suture. And we use that suture to sew the tendon back down to the bone. But 50% of the success of a surgery for rotator cuff repair is related to the rehab and the physical therapy after.
Visit txortho.com for more information.